Welcome to a video on common terms used in phlebotomy. This video is brought to you by Vadhwani Foundation. In this video, let's learn most common terms used by a phlebotomist. Learning phlebotomy terminology allows phlebotomists to understand the language of phlebotomy and communicate with one another effectively. Therefore, phlebotomists and laboratory technicians must learn phlebotomy words in order to understand the common terms and their usage used in phlebotomy. Let's start with the word phlebotomy. In Greek language, phlebo means a blood vessel and tomy means making an incision or a small prick. Venipuncture is the procedure of inserting a needle in a vein. Earlier medical practitioners called the same procedure bloodletting. Antecubital fossa is the elbow pit or part of the arm on the opposite side of the elbow. Blood culture is a test which involves the incubation of a blood specimen overnight to determine if bacteria is present. Blood is collected in a special media which enhances the growth of both aerobic and anaerobic microorganisms. Butterfly needle is a small needle with two plastic wings attached to it which are squeezed together to form a tab that is used to manipulate the needle. This assembly is then attached to a syringe or vacutainer for the purpose of drawing a blood sample. CBC means the total count of red blood cells, white blood cells and platelets per cubic millimeter that are present in a patient's blood sample. Centrifuge is a laboratory apparatus that separates mixed samples into a homogeneous component with layers by spinning blood sample at high speed. Different constituents of body fluids are separated on the basis of their density by artificially increasing gravity in a centrifuge. Cephalic vein is a large vein of the arm that empties into the axillary vein. It is also known as antecubital vein. Coagulation is the process of clot formation. It is a part of an important post-defense mechanism called hemostasis. EDTA means ethylene diamine tetraacetate. It is a calcium chelating or binding agent that is used as an anticoagulant for laboratory blood specimens. It is also used in the treatment of lead poisoning. Hematoma is a tissue filled with blood caused due to breakage of a blood vessel. Median cubital vein is vein in the forearm that is most commonly used for venipuncture because it's the largest and the best anchored vein. Palpate means to examine or to feel by fingers to identify a vein for drawing blood in case of venipuncture. Vasovagal syncope is a condition of a temporary loss of consciousness or fainting due to a reduction of blood flow to the brain. Vacutainer is an equipment used to automatically aspirate, which means draw blood from a vessel during venipuncture. Whole blood means the blood from which none of the elements have been removed, such as red blood cells, white blood cells, and platelets.